Doss. IEP, you're with IEP, but you're also with Henry Ford.
Absolutely,
Jackson.
yes.
How are you?
I'm well, thank you so very much for having me this morning.
Yes, we're so glad to have you.
It's a real pleasure.
So tell us a little bit about, you guys are always striving for a better patient experience within the health system. I feel like at IEP you guys have nailed it.
I think so too.
Yeah.
I mean, I'm a bit biased, but I do think so. I think at IEP, so we're a company that work with Henry Ford, and we provide hospitals care as well as emergency medicine and observational medicine within Henry Ford Jackson Hospital. And what's quite unique is the continuum. So we have the urgent care just right down the road, and we also have services in skilled nursing. So it's almost like a golden ticket from the urgent care to the ED to the hospitalist, and then if you need to go to rehab, one company, one team, communication, working together to provide the care that is needed for the people of this community. And we're really very much invested in Jackson. I have a real passion for this community, and I think we provide a great service. Additionally, we really partner with Henry Ford. Like I was telling you before we started, I myself have many roles within Henry Ford. I'm the Chief Quality Officer for Henry Ford Jackson. I sit on the Board of Trustees for the hospital. So IEP and Henry Ford, we partner together to achieve the common aim. And let's face it, the whole purpose, the reason I come to work every day is for the patient, right? For the care that we have to provide, to relieve suffering, ameliorate lives, to keep people healthy in the community so that they could be they can live and do the things that they want to do.
As a hospitalist, what should the patient experience from admission to discharge?
Yeah, that's a really good question, and it is what any of us would want, right? From the person checking you in, or even just parking your car, or the ambulance picking you up, all the way to your discharge. You want to feel heard. You want to feel like your doctors have cared for you, that you were part of the decisions, that your opinions mattered. And that is important to us. So I think we want to obviously provide the best evidence-based medicine, give you the best recommendations that the data suggests. You see the great specialists at Jackson, we have so much to be proud of. You know, American Heart Association, gold classification for stroke, heart failure, top of the line cardiothoracic surgery, neurosurgery, orthopedic surgery, oncology care, so much to be proud of. Our patient safety indices, post-op complications, hospital-acquired infections, some of the best in the system.
Wow.
Right here, just right down the road. Honestly, we have so much to be proud of. But apart from that, the people coming in, you know, we're people, right? We have a whole life of expectations, experiences that we come. You see me for an average length of stay is about 4 days. So you see me for about 4 days, plus or minus half a day. And in that time, I get to be part of your life. You share with me things that you probably don't tell your closest friends or family, things that you need to tell me for your health. And I need to know that, I need to respect that, I need to share back so that we can form connections, so that you can feel that you're cared for, not just the medicine and the investigations and the testing, but the human aspect. And we take a lot of pride in that service, that special extra touch at IEP. And I think this country, one thing we do really well here is all of the hospital, every single hospital that's part of CMS, so Center for Medicaid Services, and everybody's on Medicare, Medicaid, we all get tested by this national survey. It's a Press Ganey's, the vendor survey that measures all of our patient experience. So every single person who's discharged from the hospital or the clinics will get a survey in the mail. You might have had one. You might have had one. I've definitely had a few when my kids have gone to the hospital. Everybody gets this survey. It's nationally available online. I'm not telling you any secrets. The 3 questions that are attributed to the doctors. They are, did your doctor treat you with courtesy and respect? Did your doctor listen to you? Did your doctor explain things in a way that you can understand? Basic.
Simple.
Simple. Everyone should feel like that every single time. Not some of the times, not most of the times, but all of the times. And that is what we want for every single life that we care for at IEP.
How important was that role during COVID when the communication breakdown was just a total question?
Well, you know, I was here on this show during COVID. We learned so much from it, though, communication in particular. because at the very beginning, with all the PPE and isolation and families not being able to come into the hospital and visitor restrictions, it was difficult. Yeah. We had to be creative. We had to leverage technology and use iPads and FaceTime and phone calls and virtual medicine. And what we've learned from that has continued. Virtual medicine is now huge, right? Yeah. And how do we reach people who can't get to us? The extra step of making sure we communicate with families. We have a whiteboard in every room. We use the whiteboard now as a way to communicate with doctors, doctor to doctor, doctor to patient, patient to relatives. The whiteboard should have your doctor's name, your nurse's name, your plan for the day, and many different things are on that board. So we have definitely learned how to communicate through COVID, for sure. And it's not just communication with patients. That is essential, but communication amongst us providers, right? It's frustrating. You see 10 different doctors and everybody tells you something slightly different, and you're like, I'm not sure what's really going on. The hospitalist, me, my team, we're the ones, we're like the captain of the ship. Okay. We pull it together. We see you every day. We put your notes in, we talk to the nurses, we speak to the consultants, we do your discharge. We're supposed to sort of plan your discharge in a way that you're wrapped up, I say, in like a little present, ready to go with all of your follow-up appointments. You know what you're doing next, you know what your medications are, what the changes are. That's our role. And we've learned how to communicate amongst ourselves even better.
Well, you mentioned that you guys have a lot to be proud of, and you're so right. And the services that are now available to our viewers right here in Jackson at such a high level of quality is phenomenal.
I agree.
What things are you looking forward to in the future?
Wow, so much, right? We're always aspiring to be better. I think we want to be a place that people, they don't think twice to get care at Henry Ford Jackson. I would easily go to Henry Ford Jackson ED and see any physician there and my family. We want to make sure that we keep people healthy in the community. So a big focus on public health and preventative medicine. So even before you get to the hospital, like how do we keep you healthy, living healthily in your community? And how do we get you access to care, which is a barrier in Jackson, right? For many reasons. How do we make sure there are same-day appointments? That we, as a healthcare professionals, that we educate you about your care and your health and get you to buy into, because life is busy and people have a lot of things going on with limited resources, right? And you sometimes have to make difficult choices. So how do we bring care to the community? First, exciting, looking forward to that. And then when you do get to the hospital, which will happen, may happen, how do we make sure that we care for you in a way like you were my brother, you were my sister, you were my child, you were my father? Every single time, not some of the times or nearly all the times, but every single time. And every person that touches you, the person registering you, the person taking your meal order, the person wheeling you to x-ray, everybody.
Well, I feel like with her and people like Dr. Kim and so many people at the helm, I mean, we're in very good hands here in Jackson County.
Well, we work hard for y'all.
Yeah,
for sure.
I think so. I'd agree. Going to IEP has been a game changer for this town. So
it's kind of more like a spa than a
it
doctor's
is
office.
a little bit,
Really?
a little bit like
Maybe
that.
we should have a health spa.
There you go. You guys will do a great job with that. Dr. Saira Doss, thank you so much for joining us today.
Thank you so much for having us.
Appreciate it. More of the show right after this quick break.